So this is a case of traumatic zonular dialysis, and you can see there is almost 3 clock hours of zonular dialysis, and that was the rexis, and now the hydro is being done. The nucleus is being trying to be delivered through the rexis. And here, the surgeon has chosen to do a small incision cataract surgery just in case while delivering the nucleus, if the entire bag comes out, and possibly he thought that, and then you can have the better control over them rather than trying to do a phaco. Now you can notice this as soon as the nucleus was delivered, and now once the nucleus is delivered, and you can see the zonular dialysis as part has become slightly lesser prominent, and that possibly is because there is a forward shift of the posterior capsule, which tends to go a little more. I mean, tends to move a little more anteriorly, and that is the reason why this dialysis has become less prominent. So while you're aspirating the cortex, always remember that you need to aspirate the cortex. The last part of it is near the area of the dialysis, because just in case you're trying to pull the cortex near the dialysis area, you can actually increase the dialysis. And hence, first clear off the cortex all around the area, and the last area to be cleared is the dialysis area. Now you can see here that there is a subincisional cortex. A little amount of visco is pushed to make sure that the chamber doesn't collapse. The hands have been changed and a good IA has been done. And once the irrigation aspiration has been done, you can actually see at this point of time the dialysis has become even less prominent. That is, and now at this point, a single piece acrylic lens has been placed. Initially, they tried to use the loops in the direction of the dialysis, but they could identify that at this particular point of time, the centration was not really good, and so they decided to make sure that they put the loops in the vertical direction, that is in the 12 o'clock and the 6 o'clock position. And you can see that the IOLs was centered. This patient was followed up almost for more than a couple of years now, and the IO is very well centered, and the patient is reading good vision, 6 by 6 vision in this particular, and the dialysis part of it has not progressed till today. Now you can see that the wound has been hydrated, and then once the wound is hydrated, you can actually see that the IOL is properly centered, well centered in the bag, and a drop of betadine has been added at the end of the surgery to make sure that there is no leak. Thank you.